Have you ever wondered how doctors keep a close eye on your health journey, especially when facing something as challenging as cancer? It is like having a carefully planned roadmap to track progress and ensure you are heading in the right direction. When it comes to cancer markers, there is not one single answer for how often they are checked. The frequency is highly personalized, varying significantly based on several crucial factors, including the specific type of cancer, your stage of treatment, and your individual health needs. Think of cancer markers as tiny clues that doctors look for in your blood or other bodily fluids. The reason the checking schedule differs so much is because these clues behave differently depending on the cancer. For instance, some markers are very specific to certain cancers, while others can be elevated for non-cancerous reasons too. For stomach cancer, common markers might include CEA, which stands for carcinoembryonic antigen, or CA19-9. These are proteins that can sometimes be found in higher amounts when cancer is present. However, their levels can also go up due to inflammation or other benign conditions, so they are always interpreted alongside other diagnostic tests. During active treatment, your care team might check markers more frequently, perhaps every few weeks or months, to see how well the treatment is working. This helps them understand if the tumor is shrinking or if new growth is occurring. If you are in remission, meaning there are no signs of cancer, the checks might become less frequent, perhaps every 3 to 6 months, as part of a surveillance plan. This helps detect any potential recurrence early. The goal is always to find the right balance between effective monitoring and avoiding unnecessary tests, which can cause anxiety. Your personal baseline levels, which are your marker levels before treatment began, also play a big role in how changes are interpreted over time. To truly understand your personal schedule for cancer marker checks, the best step is always to have an open conversation with your oncology team. They will explain which specific markers they are tracking for you, why they chose those particular ones, and what the planned frequency of testing will be. Feel free to ask questions about the purpose of each test and what the results will tell them about your situation. It is important to remember that cancer markers are powerful tools, but they are just one piece of the puzzle. They help give your doctors a picture of your internal landscape, sometimes even reflecting what is known as tumor burden, which is the total amount of cancer cells in your body. However, they are not used in isolation to diagnose cancer, and a single elevated marker does not automatically mean cancer has returned. They work best when combined with imaging scans, biopsies, and your overall clinical picture. Ultimately, the frequency and interpretation of cancer marker checks are a carefully choreographed dance between your medical team and your unique health journey. By staying informed and maintaining clear communication with your doctors, you empower yourself to navigate your care with confidence and peace of mind, understanding that every check is a step towards your continued well-being.